HIMSS 2018 right here from Las Vegas, Nevada. Scott Adams here with you. Time now to talk with CommonWell Health Alliance Executive Director Jitin Asnaani. And Jitin, what's in store for 2018 and beyond for CommonWell Health Alliance members?
Well, you know, this year we have so much work happening across our members of the Alliance. We're continuing to drive deployment of our services through our core EHR members. We're enabling new participants within our Alliance who serve other care settings to also be exchanging. And we're looking beyond the walls of the Alliance as we continue expanding to the larger community. We're also looking at other communities that have formed, like Care Equality, and we're getting live with them so that we can exchange data and really follow the patient wherever they go. That's really going to dominate the agenda 2018, just continuing to drive out that impact. And if you look beyond that, you know, the ONC just released the draft TEFCA rule, and the draft TEFCA rule is what's going to dictate where the industry goes in the longer term. CommonWell has been very supportive of the rule, and we have a very clear role within it in enabling nationwide interoperability. And so that's really what we're starting to think about over the next 2-3 years. How do we position ourselves to make that vision successful?
Now nearly 80 members now amongst the Alliance. How can they continue to maybe break down some of those interoperability barriers?
You know, they can do a couple of things, and they do it so well. You know, number one is execute. Just continue driving CommonWell services to their client bases, bringing out that value proposition and bringing in providers and patients into the network. The second thing is they're bringing this. If you think about this 80 members, it's not a very homogenous group. We have folks who are focused on population health, on personalized medicine. We have government agencies, we have providers, we have EHR vendors and other types of technology vendors and networks. And they're helping us think through how do we continue expanding our model to allow all of them to plug in. It's actually a lot of work. It's actually, our hands are filled with it. But that's where they're really bringing in all of their expertise to make this just a better place to work.
You mentioned Care Equality and that partnership that developed in 2016. What progress has been made since 2016 and now?
You know, we've made some tremendous progress. You know, in December 2016, even though our network itself was still pretty young, they were just almost a year and a half off the ground, very young as well. We knew this was the way to go, so we announced it. Just late last year, middle of last year or so, we started really working towards actually making that network connection a reality. We're done with design, we're done with software development, we're done with integration testing. We're imminently starting pilots, really this spring, and we're expecting to actually have this baby alive and kicking by summer. And it'll be generally available to all of our members, to all Care Equality implementers, so that they can connect across this summer. So we're moving on it. It's going to be great because between the two organizations, 90% of acute care, 60% plus of ambulatory care, and both of those numbers are bound to grow as both organizations continue to execute and move forward.
Record Locator service. Why is that so important for CommonWell members?
You know, the Record Locator service is really a differentiating aspect for us, especially the innovations we've drawn on top of it. The Record Locator service, what does that do? That allows me to say, I don't just want a patient's data from that one particular place that I happen to know about. I want to know where else the patient's been. I want to be able to get the data from all the relevant sources so I can create a complete picture of the patient, so I can actually know the whole patient. And we've done a few different things on top of it as well. We've enabled people to actually improve the quality of the data that gets matched, because we don't have a national patient identifier. And guess what? Even if we did, you'd get incorrect data from different places. So we've done a lot of innovation around making that really effective. And unlike a sort of a generic Record Locator service, which tells you where the patient's been, we actually tell you where the data is for the patient. So you can find the data. You can bring the data together and put it together in your system, that workflow that you use on a day-to-day basis. And so you can quickly access it. From a technology vendor perspective, it's one connection and you get everybody. You don't have to do multiple point-to-points, multiple configurations, none of that jazz. One connection, you're done. And if you are a provider, you're getting this in the EHR or in the portal, whatever it is you use, it's coming right there while you're taking care of the patient. It's really like you've extended your reach and kind of view of the patient to like the entire world, rather than what's narrowly there in your subset. It's fantastic.
HIMSS 2018 marks 5 years of CommonWell and the Alliance forming. maybe share some specific thoughts and milestones that come to your mind.
You know, when you think about the milestones, you can think of a couple of, you can think about, hey, the numbers, what do the numbers look like? And we have this beautiful hockey stick forming of the actual network usage. But some of the milestones that actually strike me are a little bit more qualitative in nature. You know, 5 years ago, we announced we're going to do this big thing. We didn't actually really know what it was going to be, but we announced we were going to do it. A year later, we had pilots. A year after that, we were getting ourselves broadly deployed. We had, at some point in time, we had a site visit by the national coordinator and some of his associates come over, see in a clinic site, talking to the doctors who are using the platform and talking to them about how it's working, how it's not working, where they see improvement, where they see the opportunity. And so I think about those use cases, and now, particularly over the last year, the milestones which keep striking me, and now I feel I get them every month, is another patient we're hearing about whose severe condition has been somehow positively infected by CommonWell. Either an imaging test they did not have to do, mental anguish around not knowing what the state is, and their doctors actually able to pull together records and say, you know what, we have a much better idea of how we can help you and what your conditions are. Those are the types of things now I see them on almost a monthly basis or even better, and those are the milestones I really care about. But we've also had big numbers. We now have more than 8,000 sites deployed. Those are big numbers in terms of the number of records pulled and so on, millions and millions now every month, every couple of months. It's just fantastic. So many milestones, it's kind of hard to count them all.
Well, and finally, we'll leave you with this. ONC recently deploying TEFCA. Why is that so important for our CommonWell Alliance members?
So when CommonWell was formed, the notion from the beginning was wherever the individual goes, their data should follow them, should be available to them, should be available to those who can take care of them. ONC articulated TEFCA and this draft rule, and it basically said almost exactly that, but writ large, like as a national policy. And so we're super supportive of that knowledge, of that vision, obviously, because it emulates our own. But because ONC is going down the path of trying to articulate a pathway for the entire nation to get there, we're looking at our role within it, our role to be supportive of that vision, our role specifically to help our members to get across those lines to actually make that reality. And it's going to drive our program probably for the next few years as we make it a reality.
Amazing growth over the course of the past 5 years. Jitin Asnaani, as he is the Executive Director here of CommonWell Alliance. Jitin, appreciate it as always. And for more information, you can always log on to CommonWellAlliance.org.